Smoking. Cigarette smoking is the #1 cause of preventable disease and death worldwide. Smoking-related diseases claimed over 393,000 American lives each year. Cigarette smoke contains over 7,000 chemicals, 69 of which are known to cause cancer. Smoking is directly responsible for approximately 90% of lung cancer deaths and approximately 80 to 90% of emphysema and chronic bronchitis deaths. Smoking harms nearly every organ in the body. It is also a cause of coronary heart disease, stroke, and a host of other cancers and diseases. Nicotine is the ingredient in cigarettes that causes addiction. Smokers not only become physically addicted to nicotine, they also link smoking with many social activities, making smoking an extremely difficult addiction to break. Cigars contain the same addictive, toxic, and carcinogenic compounds found in cigarettes and are not a safe alternative. In fact, a single large cigar can contain as much tobacco as an entire pack of cigarettes. Smokeless tobacco causes significant health risks and is not a safe alternative to smoking cigarettes. It contains the same addictive chemical, nicotine, that is in cigarettes, which can lead to addiction and dependence. The amount of nicotine absorbed from smokeless tobacco is 3 to 4 times the amount delivered by a cigarette. Secondhand smoke is a serious health hazard, causing close to 50,000 deaths per year. It can cause or exacerbate a wide range of adverse health effects, including lung cancer, respiratory infections, and asthma. Secondhand smoke is especially harmful to young children. Secondhand smoke is responsible for between 150,000 and 300,000 lower respiratory tract infections in infants and children under 18 months of age and causes 430 sudden infant death syndrome deaths in the U.S. annually. Most smokers today know that smoking is bad for their health and harmful to people around them. They know they should quit, but they also know it's going to be hard. Fortunately, there's lots of help available. Quitting smoking often requires multiple attempts. Using counseling or medication alone increases the chance of a quit attempt being successful. The combination of both is even more effective. There are medications approved by the U.S. Food and Drug Administration to aid in quitting smoking. Nicotine patches, nicotine gum, nicotine lozenges are available over the counter, and a nicotine nasal spray and inhaler are currently available by prescription. Preventing smoking. The majority of today's daily smokers began smoking before they were 18 years old. But youth smoking can be prevented with the combined efforts of families, schools, communities, and policymakers. Parents can set a positive example for their children by not smoking themselves and keeping their homes smoke-free. Why kids start. Almost 70% of adult smokers began smoking before they turned 18. Most smokers try their first cigarette around the age of 11, and many are addicted by the time they are turned 14. So why do kids start smoking in the first place? Their parents are smokers? Peer pressure? Their friends encourage them to try cigarettes and to keep smoking? They see smoking as a way of rebelling and showing independence? They think that everyone else is smoking and that they should too? Tobacco advertising targets teenagers. Tips for parents. Even though smoking is glamorized in movies and television, remember that parents are the most important influence in their children's lives. Tell your children honestly and directly that you don't want them to smoke cigarettes. Give them clear, consistent messages about the risks of smoking. Start talking to your kids about smoking when they are 5 or 6 years old and continue through their high school years. Explain the health dangers as well as the unpleasant physical aspects such as bad breath, discolored teeth and nails of smoking. Set a good example for your kids by not smoking. Parents who smoke are more likely to have children who smoke. If you're a parent who smokes, the best thing you can do is quit. Talk to your kids about how difficult it is to quit smoking and how much easier it would have been if you've never started smoking in the first place. In the meantime, don't smoke around your children and don't ever let them have any of your cigarettes. Establish a smoke-free policy in your home. Don't allow anyone to smoke indoors at any time. If you caught your teen smoking, try to avoid threats and ultimatums. Ask a few questions and find out why your child is smoking. He or she may want to be accepted by a peer group or want your attention. Talk about what changes can be made in his or her life to help your child stop smoking.